Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to the latest Celiac.com news. Gut healing after a celiac diagnosis. What science says about recovery time? Getting a diagnosis of celiac disease often brings both relief and worry. Relief comes from finally understanding years of digestive problems, fatigue, or nutrient deficiencies. Anxiety follows when realizing recovery means a lifelong commitment to a strict gluten-free diet and patience as the body heals. Celiac disease damages the small intestine's villi, the tiny projections that absorb nutrients. Once gluten is removed, these villi can regrow, but the process varies for each person and usually takes longer than expected. When someone with celiac disease eats gluten, the immune system attacks the intestinal lining, flattening the villi and reducing nutrient absorption. This leads to fatigue, anemia, and bone loss from deficiencies in iron, calcium, folate, and vitamin D. Even after eliminating gluten, the gut needs time to calm inflammation and rebuild. Healing depends on factors like age, health, disease duration, and hidden gluten exposure. Research shows that children often recover faster, sometimes within a year of going gluten-free. Adults, however, may need 2 to 3 years or longer for complete intestinal recovery. One long-term study found only about one-third of adults had fully healed intestines after 1 year, and some still showed damage even after 5 years. Symptoms may improve quickly, but microscopic healing takes far more time. Several factors slow recovery: older age, severe initial damage, long-term untreated disease, nutritional deficiencies, or even trace gluten exposure from contaminated kitchens. Other autoimmune or digestive conditions can also interfere. While the intestine normally renews itself every few days, ongoing immune activity delays repair. Most people feel better within weeks of starting a gluten-free diet. Bloating, pain, and diarrhea ease, and energy returns. Yet symptom relief doesn't always mean complete healing. Doctors track recovery by monitoring symptoms, checking antibody levels, testing nutrient status, and sometimes repeating intestinal biopsies 1 to 2 years later. Nutrition is crucial to healing. A balanced, gluten-free diet rich in protein, iron, zinc, and vitamins A and D supports tissue repair. Probiotics and fiber from gluten-free grains help restore gut balance, while healthy fats from olive oil, nuts, and avocados reduce inflammation. Staying hydrated and avoiding overly processed gluten-free snacks also promote recovery. Some patients continue to struggle despite strict adherence, a condition called non-responsive or refractory celiac disease. This can result from hidden gluten exposure, bacterial overgrowth, or other intolerances. Persistent symptoms or elevated antibodies after a year warrant follow-up testing and possibly dietitian support. Gut healing is as emotional as it is physical. Adjusting to a gluten-free life can feel isolating, and slow recovery can test patience. Support groups, counseling, and online communities help maintain motivation and a positive outlook. Each step toward healing, no matter how gradual, brings renewed energy and confidence. Ultimately, recovery from celiac disease is not just about removing gluten, it's about rebuilding health. The body has an extraordinary ability to heal once the immune trigger is gone. With consistency, nutrition, and patience, the small intestine can regenerate and regain full function. For those with celiac disease or gluten sensitivity, this journey is a testament to resilience, the path toward restoring energy, strength, and trust in food again. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.